right. Good evening, everyone. My name is Omobola Okoye. I'm a second-year dermatology resident at SUNY Downstate. And on behalf of my co-authors, it is my pleasure to present the findings of our review on non-ablative fractional lasers for laser-assisted drug delivery. So these previous slide was our relevant disclosures. So lasers disrupt the skin barrier, assisting in delivering of any topicals applied then after, and this process is known as laser-assisted drug delivery. Although guidelines emphasize ablative fractional lasers for laser-assisted drug delivery, non-ablative lasers are gaining attention. They are less invasive, sparing the epidermis, and therefore have less downtime, discomfort, and adverse effects. So a comprehensive search was conducted in PubMed utilizing the listed keywords, articles focusing on the assessment of non-ablative lasers for laser-assisted drug delivery. In human subjects for cutaneous indications were selected for inclusion. So 18 total studies encompassing 297 patients met inclusion for the listed indications, lasers and topicals delivered. And then next, I will provide a brief overview of the findings based on topicals delivered. So for antioxidants, the 1927 nanometer outperformed the 1440 nanometer diode laser for delivery of antioxidants even at low power. However, the 1440 nanometer diode at higher densities and peak power may overcome this limitation. Studies also support use of home 1440 nanometer diode devices for antioxidant delivery when treating photo damage. Regarding growth factors, increase in hair growth and density was observed after 5 treatments of the 1550 nanometer erbium glass, followed by topical finasteride plus growth factors, but this study lacked a control group. And then a split study evaluating the 1927 nanometer thulium laser showed that hair density and diameter improved on both sides. Essentially, improvement was seen regardless of the growth factors. Thus, hair growth may have been attributed to intrinsic cytokines and growth factors released during wound healing following the laser treatment. And growth factors may not necessarily improve outcomes. So a study on human umbilical cord mesenchymal stem cell-derived exosomes showed that either the 1565 nanometer erbium glass, microneedling, or plasma devices showed significant improvements in melasma, and there was no statistical differences between treatments. Although the study support the use of non-ablative fractional lasers for delivery of exosomes in melasma, larger clinical trials are needed to distinguish its role compared to other drug delivery devices. So for PDT, a comparative study of 1540 nanometer erbium glass at low pulse energy of 26 millijoules versus curettage, microdermabrasion, microneedling, and CO2 for laser-assisted drug delivery of MAL prior to PDT found that only the erbium glass was ineffective. However, another study found that higher fluences of 15 millijoules with prolonged incubation of more than 60 minutes improved porphyrin fluorescence. Thus, higher fluences of erbium glass may be needed to enhance photosensitizer uptake. And then regarding tranexamic acid, low energy 1927 nanometer thulium was found to improve melasma 3 months post-treatment, yet studies either lacked a control arm or statistical significance was compared to 1927 nanometer alone. Melasma recurrence is well described 3 months following 1927 nanometer thulium, and current studies suggest that laser delivery of tranexamic acid does not alter these outcomes. And then regarding bimatoprost, studies showed that delivery following 1927 nanometers or 1515 nanometer erbium glass for hypopigmented scarring both showed improvements, although studies had several limitations. And we know that non-ablative fractional lasers alone improves hypopigmentation through stimulation of melanocyte migration, and current studies do not support that bimatoprost improves outcomes. And then a study evaluating botulinum toxin following 1565 nanometer erbium glass to periocular skin showed improved lines and laxity. However, the study lacked randomization and statistical analysis, and higher powered studies are needed. So to conclude, non-ablative fractional lasers are a promising treatment. The literature supports its use for antioxidants, exosomes, PDT, and Botox. However, the jury is out for growth factors, tranexamic acid, and bimatoprost, and further studies may shed some light. I want to say a special thanks to Dr. Salome and Dr. Dover for the opportunity to work with them and their mentorship. And thank you all for your attention and the opportunity to present this research.